A Mazor Robot is a robotic platform that we can use in spinal surgery to place the screws in the spine that we need to perform scoliosis corrections. And the innovation there is that the accuracy is incredibly high. And also in many cases, it can allow us to place the screws in a more minimally invasive manner.
Using the Mazor in the pediatric versus the adult healthcare environment, the pediatric patient is smaller, their anatomy is smaller, and therefore your window in order to place your screws is more narrow. Since incorporating the Mazor technology, we have seen improvements in multiple realms. One is the minimally invasive nature, and so there's less soft tissue dissection that can help with pain control post-operatively. And then also we can maximize the size and length of screws. And so biomechanically, we can get a more stable construct and decrease our risk of any hardware or implant issues in the future. There are a few different spine conditions that it works really well for. One is scoliosis, so a curvature of the spine, where sometimes the anatomy can be different. And then another one that works really well is called spondylolisthesis. And that's where one vertebrae slides forward on the other vertebrae. And so that can also change the angle of your screw placement. And so the Mazor can help with that.
I think one great example of how we've been able to use this and really change the way that we've done a procedure is for a common problem that causes back pain, particularly in adolescent patients. It's called spondylolysis, and we have had excellent results thus far with really just making about a 1-inch incision or less and being able to place our screws through that incision with very high accuracy. And those patients have had a substantially faster recovery than the more open, invasive technique that we used to use for that same operation.
One of the most successful outcomes that we've had is the first patient we ever did a robotic assisted Sheila on. She had syndromic scoliosis. She has Prader-Willi syndrome. And so she had severe thoracolumbar scoliosis, which means the curve is a little bit lower in her spine. And it was severe and surgical in magnitude. And so what we needed to do was straighten part of the spine and fuse it together and then let her grow above and below it. And then we've used it a few times after her too, and they've all done exceptionally well.
I would like parents and patients to know that this represents a huge investment on the part of Arkansas Children's to being at the leading edge of spine surgery and spine technology, and that we can offer the very best and that we are constantly looking for new ways to do things better and more safely.
There's a great deal of pride within the Arkansas Children's family that we can deliver the best quality care that's cutting edge, state of the art to the children of Arkansas. But that is also balanced with a sense of humility within the operating room, that we all know that we're working together as a team, and we have one of the world's greatest teams here at Arkansas Children's.